And could you go over again the difference between the coronary CTA and a standard cardiac catheterization?
Okay, a standard cardiac catheterization is where they'll take a catheter, a long tube, and they'll usually go in through your leg.
Yeah.
Sometimes they'll go in through your arm, and they'll snake that past your aorta into your heart, and then they'll go into the specific coronary arteries. The risks of that procedure include causing a stroke because they go across the origins of the carotid arteries and the vertebral arteries. It also have a risk of injury to the coronary arteries themselves because they put the catheter in the coronary arteries. So there are a number of risks with that procedure, although it's still the gold standard. And if you know somebody has coronary artery disease, maybe they have a stent in, and you have a high suspicion, I would still recommend they go to coronary angiography over CTA. CTA is really more of a screening test for someone who is at high risk, or they have atypical chest pain, someone that you think is going to be okay, and you don't want to put them through the risk of the conventional angiogram. So CTA is a great test, but it's not for everyone, and we want to be careful not to overutilize it.
Now, magnetic resonance imaging has been around, what, 15 years, 10 years, something like that?
Now, MRI has been around since the early 90s, actually even the 80s.
Okay.
The scanners have come a very long way since that time. Scanners, up until very recently, everyone has heard of MRI with the long tube, coffin-like experience, and that's been the experience up until about 1998, when they came up with some shorter bore MRI machines. And then recently, about 5 years ago, Siemens introduced a high field strength magnet that has a wider diameter bore. And you've heard about open MRIs and closed MRIs and high field strength, and we can talk briefly about that. Open MRI, think about two big pancakes that come down like this. These are magnetic, basically giant magnets, and they come down like this, and a patient lies in the middle. And so the magnet is sitting there over their face like this, and they can look out to the side and see that it's open. So claustrophobic patients like that because they can see the opening, versus being in a 7-foot-long tunnel, which can be pretty scary for people. The problem with the open MRI is that it's a very low-powered magnet. It's say a 0.3 Tesla magnet. May confuse people, Tesla, whatever. The point is, the stronger the magnet, the higher the Tesla number, the better the signal. The more we can see, the higher the resolution. So if you take a 0.3 Tesla magnet, that's an open magnet. Then you take a 1.5, which is your standard research-grade magnet. It's significantly more. It's 5 times more power. And now we're introducing 3 Tesla MRI. That's 10 times the power, 10 times the signal that you get out of that. So it's a tremendous advantage to have a closed system. That's why we don't like to use open MRIs. And at Windsong Radiology, we do not use open MRI because of that problem.
Now, when you have an MRI, do you inject anything in the bloodstream, or is it strictly just off the magnets and what the computer is picking up? I mean, is there any invasive anything with an MRI?
We do many MRIs without any contrast at all. For example, a knee MRI, a routine knee MRI, doesn't have any contrast injection. Contrast we do use in cancer studies, because contrast will show things that you might not see with just a conventional MRI. The contrast amount is very small. We're talking just a few cc's of contrast, and it's a very low likelihood of any sort of contrast reaction. It's a very, very safe dye that we use, much safer than the CT dyes, and much safer than many drugs that you get. People can have reactions to anything, sometimes penicillin. The gadolinium that we use for contrast is very, very safe, and so we will use it when necessary. I want to get back briefly, though, to what we were talking about with the coffin-like feeling, because I think a lot of patients get worried when they hear about MRIs, and they worry about that 7-foot-long bore. And what Siemens introduced recently, I've got a little prop here to show you. Most MRIs are a 60-centimeter bore. People aren't very used to centimeters, so I brought this little prop to show you. This is a 60-centimeter bore. This is the size of most MRIs out there. So your body would fit inside that, and you would fit, but your head is right here, and you're looking at this tube. It can be pretty scary for people.
How long do you have to sit there?
Well, an MRI typically is 30 to 45 minutes. So it's a fair amount of time, and if you're inside of a tunnel like that, it can be scary, and that's why people like the open MRIs, even though the image quality is poor.
Did anybody ever make an MRI with a television screen that you could watch something?
They do. They have little mirrors that you can see.
They could watch Medical Matters.
They could watch Medical Matters.
There we go.
This could be great.
What people like even better than that is to have their head out of the magnet. And we actually have With the machine that we currently have, it's a shorter machine. It's about 5 feet long. So for most scans, your head is out of the magnet. And the other thing that Siemens has done is made it so that you can use our bore is 70 centimeters. That's the size of the bore now. So as you can imagine, your head's down here, you have all this space if you happen to be in the magnet.
Can you eat snacks while you're having an MRI? Are you allowed to eat an apple or a peach or something like that?
You can't eat snacks and you can't move around. Motion kills an MRI. We try and keep our scans as short as possible. You're in there for 30 minutes, but each sequence that we run is only a couple of seconds long. That doesn't sound very
American. Americans don't like to sit still for 40-some minutes. This is the day of McDonald's. Everybody wants instant gratification. That's the problem with the MRI, no instant gratification.
But that's where you want a very fast scanner. That's why you want a 3 Tesla or a 1.5 Tesla scanner. And the other thing that's happening with MRI is they have more and more channels, just like television. We have more channels. Well, the old scanners that you see, most of them around town, are going to be 1, 2 channel systems. What we've got at Windsong is an 18-channel system. The reason you want more channels is the more channels you have, the faster you can scan. So I could scan your brain. I could get a brain scan on you in as little as 15 seconds. Even if you were moving, I could get some nice pictures. But if I want really, really crisp pictures, if I want to see the tiniest structures inside your brain, it's best if you hold still and I do a 3-minute long scan. Then I can get a beautiful picture and I can see the tiniest little vessels. That's the ideal.
This is an off-the-wall question here, but you know, as I talk with you, I realize that if I were sitting next to you in an airplane, I was the average American, I wouldn't have any idea about anything that you do as a general rule. What's it like to be in a career where nobody understands what you do?
Well, we interact mostly with specialty physicians.
Okay.
So patients don't come to us and say, I need a test because my back hurts.
Okay.
They go to their doctor, and then their doctor, having known us and know the type of work that we do, will say, well, Windsong Radiology has the best equipment, they have fellowship-trained radiologists, I'm going to send you there for this specific test. Now, often doctors will call us and say, what test should I use? I've got a patient with a lung lesion, I see it on an x-ray. Should I get a CT? Should I get a PET CT? What should I get?
So you're working with doctors, not so much the general.
Yeah, I mean, I find it gratifying, Dave, because I consider myself the doctor's doctor.
Okay.
You know, the patient goes to their primary care physician and has back pain, and then the doctor calls you up and says, "Hey, you know, Raj, what do I do for Mr. Smith?"
Mm-hmm.
And I said, "Well, get an MRI of the lumbar spine. Let's see if he's got a disc bulge or disc herniation that's perhaps pressing on a nerve root and causing."
So they
back
understand
pain.
quite a bit about what you do, but not as much as you know.
That's right.
Okay.
That's right.
Great. Well, it sounds like really a wonderful career to be in, and most of the people that I've talked with just love it very much. Thanks so much for joining us. This has been a wonderful show. We've been learning more about Windsong Radiology and some of the latest in some of the technology. You might want to watch the show, as I'm going to, 10 or 12 times to see if I can really understand all of it. But thanks for joining us, and we'll see you again soon on Medical Matters. For more Medical Matters television shows, go online to medicalmatters.tv.